Antibiotics are medicines that destroy or slow the growth of bacteria.
Antibiotics kill what we call susceptible organisms. So if in a dish you have a bunch of bacteria and you pour some antibiotics on it, it's going to kill those bacteria which are susceptible to that antibiotic. Now, just like every other organism, bacteria themselves have a vested interest in surviving. So they find ways of resisting, and they find ways of passing on that resistance to their offspring.
Family physician Dr. Orville Nemard says the drug cannot treat viral infections such as cold and flu.
A lot of times with viral infections, there is inappropriate use of antibiotics. So for the common cold and flu symptoms and so forth, persons may get antibiotics. Now, this is not to say that you can't get what we call a secondary bacterial infection. If that is there, then yes, you do need the antibiotics. But a straight viral infection will not qualify. So urinary tract infections, lower respiratory tract infections, and so on, skin infections, those are legitimate indications for the use of an antibiotic.
Another challenge with antibiotic resistance is when people are prescribed the drug but do not complete the course.
And sometimes, having not used the rest, they come back and they use it thinking that the antibiotic or the particular drug is still good, only to discover that the expiry date has passed and it is not effective. And therefore, they're using drugs which are not effective, and therefore they're life-threatening. And people have died as a result of this.
People are being advised to stop abusing the drug and use it only when necessary and as prescribed.
Firstly, it is patients themselves understanding that an antibiotic is not a magic pill. You know, I find very often patients come in and they're having a pain. They bump their knee and they're asking for an antibiotic. An antibiotic has no indication there. If it's not a bacterial infection, it has no value. And the same applies also with us as practitioners to being a little more clear and sticking to the guidelines in terms of limiting our prescriptions, paying attention to our prescribing habits.
With your health report, I'm Shamela Pullen wishing you good health.